Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Well, doing okay, all things considered.
Absolutely. Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest COVID statistics and headlines through today, February 7th. We invite you to submit any questions or suggested topics down below or via any of our social media linked in the description. Starting with that COVID statistic, average COVID deaths per day in the last week were 95. The same week in 2024, we saw 337 COVID deaths. Dr. Murphy, your reactions to those numbers?
Well, definitely much better than last year. So every year this is going down, down, down. As we get more and more immunity, more people take vaccines, more people get infected. That gives you immunity as well. So that part is good. What's maybe not so good is that the number of deaths, this is per day, okay, is 95. That's up a little bit. It had been down below 50. But, we've been in the respiratory infection season, since the end of December, beginning of January, really took off. And so this is the consequence. You pay later. People get infected. Takes a while for them to get sick. They get more sick. They go to the emergency department. They get admitted to the hospital in the ICU and so forth. And the people really at high risk, a lot of them don't make it. So this is very typical. So the mortality rate goes up as the season goes on.
And sticking with flu and looking into another respiratory disease, which is flu, there was a really interesting study done about COVID and flu co-infection and how often that happens. Can you break it down for us?
Yeah, this actually surprised me. I didn't realize it was so high. So there was this big meta-analysis, in other words, looking at a variety of studies that have been reported. And they classify the studies as being strong, moderate, or weak, whatever. They look at the best ones, and the overall prevalence or the amount of influenza A and B, which is about a 3-to-1 ratio, plus COVID-19 was the co-infection rate was 14%. And I just thought that was I was surprised that it's really so much. And why is that important? Well, it's important because there's different treatments for different infections. And so you may actually have 2 infections. If you do, you can get treated with both. The reason why that's important, having 2 at the same time can really cause an overload to your immune system. And that would not be good. Maybe you can't fight off each one of them as well as one at a time. So it's just something to think about when you have an upper respiratory infection. You may actually have 2 different things. So what's happening in the diagnostic field is what they call multiplex testing. So even over the counter, you will, and this will become more and more available in the next season, is you can test for flu and COVID at the same time. And some of them will even have RSV. No real treatment for that, but there might be at some particular point. But you can get an idea with the tests that are coming up. In the laboratory, of course, it can be all tested. That's no problem. So if you go into a clinic or something, they can do all those tests. But yeah, immune overload, it's very interesting.
Very interesting and at definitely a higher rate than I would have expected. But speaking about the flu specifically, we have some real world data surrounding the most recent flu vaccines, if you'd like to break that down for us as well.
Yeah, this was reported in Clinical Infectious Diseases, a very highly respected journal. And the researchers assessed 70,000 hospitalizations and 271,000 emergency department visits. And this was done during the last season. We're not done with our season yet. So this was done for the 2023 2024 season. And in pediatrics, it turned out that those kids that had an influenza vaccine had much fewer visits than the other ones. Very significant. The difference was for hospitalizations was 85% versus 44, basically twice as good. And for emergency department visits, it was 74% versus 49% visits. So it really works. And it even protects them from going into the ICU. And then if you look at the adults, you see the same thing. And the emergency department visits was 39 and 47% respectively. Not as big of a difference, but still a difference. And for hospitalization was 67% versus 37%, of course, favoring those that had the vaccine. So that just shows you these vaccines do work and can keep people out of the hospital healthier and with fewer lower mortality.
Absolutely. And our biggest story this week is looking at a different flu. This one, the avian flu, where there has been huge and potentially very consequential news this week that we have identified another strain of the avian flu. Can you tell us about that strain and who it's affected?
Yeah, this is an unfortunate finding, but not unexpected. So this was reported in cattle herds in Nevada, the cattle herds that were not mixing with each other. So they probably they all got it from wild birds, most likely. And there's a new genotype that's circulating called D11. And this is different from the genotype that had been circulating and all the other people that have gotten sick, the 67 workers that have gotten, humans that have gotten sick, and cattle, which is the B313. Anyway, weirdly and unfortunately, the patient in Louisiana who was older and had underlying heart disease who died had D11. So not only did that patient have a high risk for avian flu, but from dying from any flu, but also had this nasty one. And if you remember back, there was a teenager from British Columbia who ended up in the ICU, recovered, and was discharged. But for a teenager to end up in the ICU from flu, pretty unusual. That person also had D11. So is this the beginning of something new and terrible? Probably, because this is most likely D11. It's popping up all over the place. The birds are all going to get it. They're going to spread it to the cows. And, you know, all we need is a different mutation to make it transmit easier, and human to human transmission might occur. So, you know, this is why we got to keep track of this surveillance. For those of us here in Chicago, if you've been walking along the lakefront recently, there have been found hundreds of dead birds. Many of them have the flu, avian flu. So please stay away from the birds. You can call the authorities to have them safely removed. You have to remove them very, very carefully, because this is how people are getting sick. They're getting sick from these animals. So don't go near them, don't touch them, and keep your pets and children away from them.
Absolutely.
Mhm.
And on this topic, I've been seeing a lot of confusion just generally that we know the seasonal flu vaccine does not protect against avian flu.
Right.
So why is it that authorities are recommending that people in contact with these animals get that seasonal flu vaccine?
Well, remember, we only have so far 67 people in the United States get avian flu from animals. All of it's from animals, you know, so far, cows or birds, and wild birds, or, you know, birds from chicken farms and duck farms. So when are they going to pull the trigger to vaccinate all these workers who work with birds or cows? That's a good question. We don't know. And there are stockpiles of this vaccine with millions of doses. Moderna was the most recent company to get an infusion of over $500 million to finish their study so that their vaccine could be put in to this pool. And especially if this D11 takes off and another person ends up in the hospital very sick or dies, I think you'll see that lever be pulled. Hopefully somebody's still left at the CDC to make that decision. The communication has been, very rough. And this is a very important time for avian flu, because if this mutates anymore, and it is going to continue to mutate, if it starts spreading to person, we got another whole problem on our hand. And a couple million doses of vaccine is not going to be enough. We have over 330 million people in the United States, let alone all the people in the world.
Yeah. And what is the huge risk if, let's say I'm a poultry worker and I have the seasonal flu, and then I come into contact with avian flu diseased birds? Could co-infection of seasonal be horrible?
Well, you could get both. They could intermix, and it's just not good.
Yeah, really not good.
Our stockpile, and basically well enough to vaccinate all the poultry and dairy workers. That will be the first step.
Now, another story that is really not good news is that we have reports out of several African countries that Ebola has popped back up. Can you tell us about the case numbers and anything that we know?
Well, in the Democratic Republic of the Congo, where a lot of Ebola has been reported in the past, there's 12 new suspected cases. 8 of them have been fatal. And this is very unfortunate. There's also been a case in Uganda where a nurse in a hospital died of Ebola on January 30th. And a second case was actually a spouse, I think, of the original case, is also sick. So we have to be vigilant about all these diseases. And Ebola is back, and we have to be careful, and surveillance has to continue.
As we have preached many episodes, diseases and illnesses know no borders, and this is exactly why we, fund global health initiatives to stay on top of these things.
Now, after the last Ebola epidemic, they set up a special Center for Disease Control just for Africa. So, we're ahead of the game, this time around. So at least there is a central authority there. Plus you have the WHO, which will also help and has emergency funds to stamp out these many outbreaks. Of course, the United States has withdrawn from the WHO, which was 18% of their budget. These kind of cases, it just shows you, we're all in this together, and to just focus on what's happening in the United States is not going to be good enough, because these things can mutate, they can transmit faster. Somebody can be over in Africa on business. Africa's a growing continent with many resources. There's a lot of travel back and forth. We have to really be careful and continue with all this surveillance. Somehow it's got to be paid for. These countries don't have the money. They don't have the resources.
Speaking of things that are happening here in the US, on top of all of that, there are several health-related pages from the CDC and other health organizations that have gone missing over the past few days and weeks. What does that mean for, health efforts and doctors looking for that information?
Somebody just was not thinking of the consequences of shutting all this communication down. An example of what has disappeared. Well, besides the U.S. Agency for International Development, which is pretty much decimated and gone, the treatment guidelines for sexually transmitted infections is taken down. Doctors all over the United States use that on a daily basis for updates and how to treat people with sexually transmitted diseases. It's gone. It's one of the biggest resources used out there. Everything about LGBTQ youth has been taken down. Where do they go now? It's just amazing. The youth Risk Behavior Surveillance System is a long-running survey that tracks health behaviors among high school students in the US. I mean, because a lot of the sexually transmitted diseases are happening in that group as they become sexually active. The whole surveillance system is gone. And probably the worst thing, and definitely the most stupid, is the webpage of the CDC about food safety during pregnancy. I mean, what is going on here? I mean, pregnant women are vulnerable to many infections, and it's gone. I just really don't get it. There's also a thing called Atlas Plus. It's an interactive tool that lets users take the public data the government has prepared from the states and put it together and let them do their own analyses, make their own decisions in their states or territories. That's also gone. This is, I mean, we're going backwards. We're going backwards in terms of healthcare and health information. I mean, we're going back to the 20s and 30s when we didn't have this information. People are going to get sick. And, you know, things like congenital syphilis are going to increase, and babies will be impacted. I mean, it just it's just someone has not thought this through, or just doesn't care, or is just cruel. I mean, I don't know what else to say.
Yeah, it's extremely careless. Hopefully those things will be back up at some point, but you know, we just don't know. To end on hopefully a higher note than that, there has been recent studies published on the effectiveness of the RSV vaccine for children specifically, those adolescents. Can you tell us about those results?
Yeah, it's actually not really a vaccine. It's a monoclonal antibody called nirsevimab, or Beyfortus is the trade name made by AstraZeneca. And it's used in young kids who are at risk for RSV. I don't know if you remember a couple of years ago before this came out, you know, the hospitals the pediatric wards were just jammed with all these kids with RSV. And so a big study has been done looking at the effectiveness, and they looked at 211 sites in 31 countries and found, looking at hundreds of patients, that this stuff really works. I mean, we already knew it worked, but it's just approximately, I mean, this is just confirms what we already knew on a much bigger scale. And it's very important information because kids can, you know, it can be given before, you know, given while they're young, and they'll get milder disease, or they won't get infected at all. You can also vaccinate the mother for RSV, and that is approved in the United States in the third trimester. Give the pregnant woman, offer the woman the RSV vaccine, and she will make the antibodies, and that will protect the kid. So it's just great news that this type of approach is effective.
Absolutely, and hopefully can prevent more harm in the future. But on that note, Dr. Murphy, I'd like to thank you for your time and expertise today, for continuing to report all of the information and keeping it real. So thank you very much.
All right, thank you. Have a good weekend.
Thank you. And thank you all for joining us this week for the Ask Dr. Murphy series. We hope to see you again next week. We will be reporting. And if you have any questions, comments, or suggested topics, things you'd like us to go deeper into, please feel free to comment them down below or contact us via any of our social media linked in the description. Have a great weekend.